Hi, my name's Abby. I'm going to be your nurse today. We're going to do a head-to-toe assessment. I'm going to provide privacy and wash my hands. We're going to start. Can you tell me your name, the date, the time, and where you're at?
My name's Nicole. I'm in the nursing building. It's 4:30 on April 24th.
Great.
23rd.
Can you state your age for me?
19.
Perfect. So she's alert and oriented ×4. We were checking for level of consciousness. Her posture is erect. Her mood and affect is pleasant. Her nourishment is well nourished. Her hygiene seems well maintained. We're going to check your vital signs. So we're checking for respirations, pulse, blood pressure, and temperature. And we're going to check your height and weight. So I'd have you come stand and do your height and weight. Can you state that for me?
5'3", 125.
Great, so I'm going to check on a BMI chart and document your BMI. After that, we're going to move on to your head and face. So I'm checking the contour of your skull, and it is normocephalic. We're going to palpate your skull and your hair, and it is free of lesions, and hair is thick, evenly distributed. We're checking your frontal and maxillary sinuses, and they are firm. We're going to check CN 5 and 7, and we're checking. Can you smile and clear your teeth and close your eyes and wrinkle your forehead and cheeks and blow your air out? And they are intact. We are going to check your lymph nodes. So we're going to start preauricular, postauricular, occipital. We're going to check submandibular and submental, and down the cervical chain and supraclavicular, and they are discrete. We're going to do the range of motion in your neck, so you can just do what I do.
Okay.
And there's full range of motion. We're going to check against resistance. And it is full and active, 5 out of 5. After that, we are going to move on to your eyes. So we're checking for perla. We're checking if the pupils are equal and round and reactive to light. And they are. We're checking for accommodation. We're checking CN 3, 4, and 6, and we're going to check the 6 cardinal fields, so just follow my pen. And they are intact. We're moving on to your ears. So we've checked for symmetry, and then we're going to palpate the pennant and the tragus and kind of move it around and make sure it's really movable and there's no pain noted. After that, we're going to use the otoscope, and we're going to pull your ear up and back, and I'm going to use my pinky for stabilization. And we are checking, and there's cerumen noted. Hair is evenly distributed. The tympanic membrane is pearly gray, and light reflex are noted. And we're going to do the same thing on the other ear. Switching hands. And cerumen noted, hair evenly distributed, tympanic membrane pearly gray, and light reflex noted. Perfect. So after your ears, we're going to move on to your nose. So we're checking if it's symmetric. We're going to check the patency. And there are no obstructions. We're going to check the mucosa. And it is pink and moist. Septum, there are no deviations, and it's intact. Hair is evenly distributed. We're going to check your mouth. So we're going to check using a tongue blade. I'm going to check the mucosa. So if you there are no lesions noted. mucosa is pink and moist. Checking the tongue and the roof of the mouth, it is veiny and midline and appears smooth on the bottom. I'm going to check the pharynx, and tonsils are 1+. Say ah. That's CN10. We're checking if the uvula rises with the ah, and uvula rises with the ah, and that's it. Okay. Something I was gonna say, but I forgot what it was. Okay, so we're moving on to your neck. Yes, moving on to your neck. Yeah. Okay, sorry, take a second to remember. I'm gonna have you lay back at a 45-degree angle, and we're checking the carotids and jugulars on both sides for distensions or pulsations. And there are none noted. We're also gonna palpate the carotids one at a time. Pulse noted 2+. Pulse noted 2+. We're gonna palpate the trachea. And it is midline, and there is rugae noted. After the neck, we haven't done range of motion yet. Okay, so we're gonna do range of motion in your neck. So if you can just follow what I do. We're gonna know. I feel like we did this, but we're gonna again. I'm getting all mixed up here. So same thing as before, full range of motion, strength, because resistance is good. Okay, we're gonna do upper extremities. So shrug your shoulders for me. This is CN11, and against resistance. Great, strength 5 out of 5. We're checking for the symmetry in the shoulders, elbows, wrist, and fingers. And we're checking the nail beds. They are consistent, symmetric. Nail bed is pink. Nails are translucent. Capillary refill is less than 2 seconds. Temperature is warm and dry. Radial pulses, present and 2+. We're gonna do range of motion. So just follow what I do. We're gonna do flexion and extension and hyperextension. And we're gonna go like this. And behind your head, and behind your back. And circumflexion. Great. Range of motion is full. I'm gonna do grips. Great. And pull my teeth and push me away. And that is strength 5 out of 5. Yes, so now we're going to move on to the heart. So we're checking in 5 places. We're starting on the right side. So in the second intercostal space, yeah, so aortic area, we're going straight across, pulmonic area, down one intercostal is Erb's point, and then down another is tricuspid, and then mitral. And we're checking for rate and rhythm, S1 and S2, S1 and S2 individually, any extra heart sounds and any murmurs. After that, we're gonna move on to your lungs. So I'm gonna check the posterior expansion of your thoracic cavity. So I'm gonna have you turn this way, perfect. And I'm gonna place my fingers and big deep breath. And make sure my hands come back together, and that was symmetric. We're gonna go ahead and do the posterior, 18 placements for your lungs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Perfect. We're going to go ahead and do the lobes of your lung while I'm on the side of the view. So this is the left, so there's just upper and lower. So we're going to go upper and lower. I'm going to go ahead and do the right. And there we have upper, middle, lower. Now we're gonna do the anterior placements. There are 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're checking for crackles, wheezes, rhonchi, pleural rub, and any adventitious sounds. After your lungs, we're gonna move on to your abdomen. So I'm gonna ask if you would just pull your shirt up for me and lie down. And we're checking for the contour, and it's flat. We're checking for pulsations of the aorta, and it is noted. And I'm gonna check her bowel sounds in all 4 quadrants. Start in the right upper quadrant. And they're active in all 4 quadrants. We're gonna palpate in all 4 quadrants as well to look for any tenderness, rigidity, or pain. A little bit harder. And there is none noted. So you can sit up for me. We're good on your abdomen. We're gonna start checking your lower extremities. The fun part. So we're gonna move on. At first, I'm gonna check the hair distribution, and it is shaven. Temperature is warm and dry. I'm checking for edema, and we check pitting, non-pitting, and then rate. There's none noted, so it's 0. We're gonna check for pulses, dorsalis pedis, noted 2+, and posterior tibial is noted 2+ as well. And then I'm going to have you go ahead and do against resistance since you're sitting. So I'm gonna have you push up against my hands and against, perfect. And that is full and 5 out of 5. I'm gonna have you, we're gonna check the capillary refill, but your toenails are painted. So we're gonna do it on your big toe, and it's less than 2. We could also check on her nails as well, like we did, and make sure. And I'm going to also palpate her heel and check if it's boggy or if there are any pressure ulcers. Perfect. And I'm gonna go ahead and have you stand for me. I'm checking for symmetry of hips, knees, and ankles. And we're gonna do range of motion. So I'm gonna have you flexion, extension, flexion, extension. And we're gonna do dorsiflexion, plantar flexion, dorsiflexion, plantar flexion, and then eversion, inversion, eversion, inversion, eversion, inversion. Perfect. So we have full range of motion, and now make sure we're good on our legs. Making sure I'm looking at everything symmetric. We're good. We're gonna move on to neuro, and I'm just gonna have you turn this way, and we're gonna check your spine. So I'm just gonna pull your, perfect. And I'm running my fingers down, checking for any curvature, scoliosis, kyphosis, and also palpating and checking for any tenderness or pain. And it looks good. Throughout the whole assessment, and especially when her shirt is up, we're checking for lesions on her skin or anything that needs to be noted, any scars. There's none. And then we're also checking her colors appropriate for ethnicity. We've checked her nail beds already. We'll just kind of check again, it says. And I'm just going to review one more time and make sure and feel like if I've gotten everything before we walk out of the room and document. Okay. I think we're good. We're gonna make sure you're in a comfortable position and go document, and I'll come back and check on you in a little.